Good morning and afternoon, everyone, depending on where you are. And thank you for joining our COVID-19 discussion series. My name is Alyson Gaffney, and I am the Executive Director with CNAR, the Canadian Network of Agencies for Regulation. With the announcements of late regarding physical distancing, limiting travel, self-isolation, and other actions being taken because of COVID-19, we've created a virtual discussion series with the objective of bringing Canada's regulator community together. Whether you are a member or not of CNAR, along with our partners, suppliers, and supportive organizations to share ideas and best practices for actions being taken during this difficult time. We launched this discussion series in March, and they have been received extremely well by the community. All previous discussions are available on the CNAR YouTube channel. Today is our fifth session titled Virtual Investigations. Before we start, a couple of housekeeping notes. Because of the tremendous response we have received for the discussions, we have set up panels to facilitate the discussion and address pre-event questions submitted by you, our attendees. All attendees are muted, but you can pose and discuss with each other topics during this 1 hour discussion via the chat feature located at the bottom right-hand corner of your monitor. This call is being recorded and will be added to our YouTube channel in the coming days. So let's get started. First of all, I'd love to introduce our esteemed panelists. We have Dean Benard, who is the president of Benard & Associates, the largest regulatory investigations firm in Canada. He has investigated thousands of matters, and him and his team have been doing remote investigative work for many years. Second, Elyse Sunshine, a partner with Rosen Sunshine. Elyse serves as independent legal counsel to numerous regulatory bodies. She also assists health associations and organizations and healthcare professionals by providing advice and opinions with respect to regulatory, administrative, and civil matters. And finally, Marc Spector. He is the Director of Professional Regulation at the College of Early Childhood Educators, one of the largest regulators in Ontario. He is recognized as a leader in regulating professionals and speaks nationally and internationally about best practices, emerging trends, and strategies for navigating a constantly evolving environment. Thank you, panelists, for joining us. We have a full house today. Over 100 attendees have registered and interested in this topic. Let's start high level, really virtual investigations. Let's discuss the legality of it. We had a lot of questions on that. And is it really appropriate for all situations? Maybe I could start with you, Dean.
Sure. I think in terms of the legality side of things, I'll probably defer to Elyse on that question. But in terms of its appropriateness in general, I think it's very appropriate. I think it's important to look at the nature of your organization. Some organizations will find it very easy to conduct remote investigations. In fact, I know several that have that well in hand before this pandemic hit. Other organizations, perhaps not so much. And we can talk a little more about that later. But I think just to give an example, I think a large organization where their members are working, let's use nurses for an example. The vast majority of nurses work in hospitals. Obtaining third-party records from the hospital is much easier. And we don't have to worry about some of the concerns that can come up related to gathering those records because we know they're coming from a medical records department in a hospital. Whereas if you're dealing with someone who's a sole practitioner, getting their records, we have questions about the validity or the veracity of the records because we don't have any control, and the only person who does is the person being investigated. So I think depending on who you investigate and the nature of the role those people have, it's going to have an impact on the appropriateness of being able to do a proper investigation virtually or remotely versus in person. I'll stop there, and perhaps Elyse and Marc might want to add something.
Thanks so much, Dean. So with respect to the legality, obviously regulators have a public protection mandate. And so we can't and don't want to keep things on hold indefinitely, although many of us would like very much to sit in our homes in our pajamas watching Netflix. That doesn't accord with our public protection mandate. There's of course, risks to the public that are ongoing, and we also had matters in the pipeline. But in terms of the legality of conducting virtual investigations, we do need to go back to whatever your governing legislation is. Of course, your legislation wasn't drafted with a pandemic in mind. And I know we've all heard the phrase unprecedented times. And of course, that rings true in this context as well. But most legislation won't have a prohibition about conducting investigations electronically. In fact, most governing legislation is quite flexible with respect to how regulators elect to conduct investigations. So certainly electronic is just another tool in the regulator's storehouse in terms of how they can conduct investigations. But then of course we get to the issue I think I'll let Marc speak to that.
Yeah, great points, Dean and Elyse. The question is, generally, do we have the answer is yes, to the extent that we did beforehand as well. But maybe a different question to ask is, how do we exercise that legitimacy, see ourselves as regulators, and how do we want to be viewed? The way we talk now during this environment, regulators, about how do they view us? Do they view us as being fair, even-keeled, sensitive to the circumstances, transparent? So in a lot of cases, the answer is yes, but really it's judgment and sensitivity to individual circumstances.
Yeah, I think you make a good point with that, Marc, because we're doing a lot of investigations right now remotely. I'm 2,000 miles away. I'm in the Dominican Republic right now and have been routinely completing investigations over the last few months without any issue at all. Definitely doable. 2 blocks or 2,000 miles, you can do it. But there are certain kinds of investigations where and you're right. I mean, do we want to do a thorough, proper, complete investigation? And is that circumstances of a particular case? We need to be looking at that question. We have a case before us. Is this a case that's reasonable to be done remotely? Things that need to be done, or are we going to forge ahead and end up on the back end of it with, with things that are missing, with holes in the investigation that could be criticized later? Every case sort of has analysis done to decide where will it be appropriate and where it won't. And of course, there's the adjustments we have to make as investigators.
Yeah, I think it's important to remember, just because we are in a pandemic doesn't mean it's a free-for-all that we can do whatever we want to do. We still have to stay and then we, of course, have a number of particular concerns, including staff safety, participant safety, that we are going to have to think about and be prepared while we do want to move matters forward.
Yeah, correctness is only part of the equation. We can have legal validity, have the powers, but what are some of the other aspects? How is it going to be viewed? Is it going to be fair? And what's a balance in this scenario? What's going to get us to where we want to go? We can be right, but we have to ask, well, so what, and at what cost?
What happens if it refuses, or can they refuse to say, hey, I will not do a virtual investigation or be involved in that?
So most includes a duty to cooperate with an investigation. So again, I don't think that legislation goes out the window at all, but it depends what we're asking the individual to do. So if we're insisting on an interview in circumstances where that safety is can't be preserved, then I think it would be reasonable for the individual that's not an appropriate investigation at that time. Again, I think it's what you're probably going to see is not out and out refusals per se, but requests for accommodation. So someone may reasonably say, I'm a physiotherapist and I work in a multidisciplinary clinic and I can't get into that office right now to get the charts because it's closed. So I think you will be seeing issues that are going to come up, as opposed to out and out refusals, although you may get some of those as well. And then you will have to determine what is the basis for the refusal? Is it reasonable? Is there another means of getting this? Or do we have to use our enforcement powers to require the individual to comply with the investigation?
Okay, thank you. Just kind of tying into that, one of the major questions that we got in the pre-event feedback form was about the processes. Is it a new process utilized before, pre-COVID, I guess is what we call it? Any important considerations we now have to take into consideration to consider? I don't know how else to say it right now. You could start.
Actually, Dean references at the very beginning, for a lot of regulators, this environment hasn't changed a lot of our processes. It changes some of the practicalities. We're all working remotely. But in some cases, regulators have already been doing virtual investigations, in fact, for many years. So the question is really coming back to something Elyse said. So our processes are the same, but how we react may be a little bit more nuanced. So for example, if someone asks for an accommodation or they ask for more time, in this environment, we're going to bend over backwards to do it if it's reasonable. It's about fairness and thoughtfulness of the entire process, but the process itself has not changed.
I would add that in terms of the process, I agree. Generally speaking, the process hasn't changed. But there are certain investigations where the process just can't happen. Like there are just certain things we're going to have to accept the fact that until things loosen up, until we can get out there and we've got cases right now on hold. For example, we've got one very large case where we just finished drafting a search warrant, the plans to go in and we can't conduct search warrants right now. We can't even see the justice of the peace to get a search warrant right now. So there are certain things that just simply won't be possible. A lot of regulators also do inspections. Well, the question is, how do you do an inspection when you can't physically go and look at what you have to inspect? Could we have the person who's being inspected use a video device and let us see? Well, maybe you could, but would that be a proper and thorough inspection? Are we going to not see things that they don't want us to see? So I just think these are all the practicalities, as Marc said, that we have to look at. There's going to be limitations. There's going to be challenges. Yes, we bend over backwards. Abuse case where I need to speak to a person who's claiming that they've been sexually abused. Being in the same room as a person who's gone through that and interviewing them is important in many ways. Integrity of the investigation, but to be sensitive to the individual you're dealing with. It's hard enough to have a conversation like that, let alone over a video. So again, we have to be aware of all the impacts of our decisions are having, not only on members, but also on complainants and witnesses and all the people involved.
Okay. Any specific risk mitigation strategies or breakout sessions, tips? That was another thing when it came to the process. Any changes there?
Well, I think, obviously you have to assess the risk. So has been said, do we need to do this investigation now? I mean, we all have to appreciate, of course, a number of professionals are not working in any event. So the risk to the public is quite low at the present time. If they're not able to practice their profession in any format, are we really concerned that there is potential risk to the public? And then, of course, if that is the case, do we want to put our investigators or staff team at risk by conducting matters? I think, like everything we're doing now, the less direct contact and paper is the best. So if things can be done electronically, that's probably going to be a way we want to do it. So whereas we often would go into someone's office and take paper records out of the office, we have to think about, do we need that? And if we do need that, how many do we really need? You know, sometimes we take, 40 patient charts, and maybe we can deal with only 10. And then what are we going to do with them? Are we going to seal them and keep them until, the virus dies potentially on them, so that we're not touching fresh paper out of someone's office? I think all of those things have to be thought of. And the other issue, of course, is that people are working from home. So are we asking our investigators to bring things into their personal homes as well that could potentially pose a risk to them or their families?
Yeah, great point, Elyse. Is that one thing it makes you do? It makes you reflect and say, why am I doing what I'm doing? What's the intent? Where do I want to go? All fundamental things that we should always be thinking about, but maybe we don't always do. And when we can ask ourselves that, maybe we realize, no, maybe it isn't that important after all. Or maybe, to Dean's point, goes, no, this is really important because this is really sensitive, important nature, and this is somewhere where we need to go. It comes back to context and balance.
And of course,
interesting.
Yeah.
Go ahead, Dean.
Oh, I was just going to say, and it's also important to recognize that we have to protect, and I think it was already mentioned, we have to protect our investigators as well. We've got to have, if we're going to send them out into the field, they should be sent out into the field with proper personal protective equipment, with some guidelines. So, one of the things we've been doing is establishing new policies for our investigators. How will you manage a site visit when things loosen up enough? We've got cases right now where we really do need to go out and get things. And so we want to make sure people are protected in how they do that. So it's really, again, we've heard the word balance a few times here today. I think it really is about balancing safety, the needs of everyone, the ensuring the fruits of the investigation are what is needed. And so that's going to be very individual from organization to organization and from case to case.
Okay, excellent. You mentioned documentation, the danger of touching the documentation. Let's continue on that theme, not the danger theme, but the documentation. How do you ensure you handle the confidentiality of the documentation that you may be getting or finding, and the videotaping and everything? So can we talk a little bit privacy, documentation, and a lot of interest in the systems and the tools that potentially some of you may be using or you have know about that are investigating that you're using? Who would like to start?
I can. Is that one specific example when we're dealing with registrants or members, sharing documents with them or obtaining documents. In this electronic environment that we're all in, what we do is, first of all, it starts with a phone call to say, we'd like to send you these documents. Is this your correct email address? Then we'll encrypt our files, and then we'll call them back with a password. That does a number of things. Other than the password protection, we're making sure that our information is accurate, that people know the information's coming, they know to look out for it, and there's a confirmation coming back that way. So that's one specific mitigation strategy that we have used.
I think it's really important what Marc's talking about. I think it would be nice if we had all had these privacy practices in place up to this point, but one thing this situation has really done is help us get the technology in place and the policies and procedures in place to make sure that we are protecting confidentiality and privacy. So Marc's right, it should start with verification that we're actually communicating to someone's correct address, because people are working from home, many people are working from home, or because people are out in the field on the front lines working more hours than they ever had. They may not have the same type of access to the types of communication they had previously, or they may be using a different address. So for example, you have a physician who teaches part-time at the University of Toronto, and they may not be accessing that email address that they use more in the past, and maybe using their own personal email address. So those types of things are, of course, important. And then, of course, when we are communicating electronically, we have to make sure that we're doing so in a sensitive and protective way. There's a lot of mechanisms now to send large documents, which is always a challenge as well, in a safe and secure way. And your organization does need to investigate and maybe unfortunately spend a little bit of money on making sure you have those systems in place. And then, of course, we have the challenges on the recipient end is, are these accessible to members of your profession? Do they have access? Can they use them? Are they unwieldy? So there are a number of challenges, but there are a number of good products already out there on the market.
Yeah, I would agree. There's a lot of great products out there. One of the challenges, I like what Marc said about beginning with a phone call. I think that I'm a big advocate for every investigation, especially in these circumstances, starting with a call and a discussion, and that not just with respect to the member, oftentimes with respect to complainants, because they may not have electronic access to things. So a lot of people don't have, a lot of us are comfortable. We have our laptops, we have our computers. There's people out there that don't have that stuff. And so we have to be aware of the fact that there will be people who will have their own challenges on their end in terms of being able to communicate with us. But generally speaking, we can at least get through to them with a phone call, and we can assess that. We can figure out what we're dealing with, and then from there, determine the best approach to take in terms of sharing documents. And there's also the challenge as well when interviewing, and we'll get to that later, I know, but in terms of sharing documents during an interview, and how are we doing that? There's great solutions for it, but you have to be aware of them and be comfortable using them.
So how about we talk about them right now then, Dean?
Okay. Well, one of them is this platform we're using right here is Zoom. With Zoom, you can do document sharing. So in the middle of an interview, you can, if I want, for example, you have to build in extra time into your interview for this, because this is going to be a much slower, you're sitting in a room with a bunch of paper and you say, take a look at this document, help me understand this entry. Very easy to do when you're sitting in a room sharing a piece of paper. A little more challenging when I have to say, okay, hang on now, I'm going to share my screen, I'm going to share this document, and then I'm going to highlight with my cursor the thing I want you to look at, and then I want you to comment on it. So right off the bat, we have to recognize that our interviews are going to be longer and a little more tedious. We also, we're sharing documents, which is great because they can look at them, but we're not giving them the document. However, from a privacy perspective, can we be sure that the person doesn't have a phone there, that they're snapping pictures of these documents, and maybe they shouldn't be having them, and now they have a picture of it? These are some of the challenges we can't really control for as easily as we would like. But there are solutions for at least sharing documents, and that we just have to be aware. Box, Hightail, the list goes on, Ignite. There's a whole slew of document sharing platforms that we can get documents back and forth as long as people have internet access and computer access. But again, with that, we have to be cautious. Now we've put these documents out into cyberspace. This person, just as easily as we've sent it, this person we've sent it to can now send it. And they could do that before. That's the reality. But there are higher risks. I think that all of the work that we're doing in a remote fashion does come with some additional risks that we have to try to mitigate for. And the best we can do is that is all we can do, is the best we can do. Maybe I'll let Marc and Elyse comment.
Yeah, really well phrased. Although the principles are constant, context is important. And not every regulator or not every situation will call for interviews conducted electronically, or whether it's through Zoom or another platform. So when it comes back to asking, what are we really trying to accomplish? In some cases, a videotaped interview is really just a proxy for ensuring accuracy. And we have to ask ourselves, are there other strategies for ensuring accuracy? Or are there other, depending on the investigation or the regulator, maybe there's already a video interview done by somebody else. Maybe it's the police, or maybe it's, in the case of my college, CAS societies. So I absolutely agree with Dean said that logic is unassailable, but I think what we also have to ask is a virtual interview even realistic? Is that something we want to do?
Yeah, and I think one other factor, of course, is coming back to what Dean said at the beginning, when we're sitting in a room together, certain things are easier. So for example, if the member has defense counsel, and I sort of made this joke when we were talking, you know, sometimes defense counsel likes to kick their client under the table or to ask for a moment to speak with their client. And of course, those interactions are just not going to be possible. And then when you know, the more bodies you add into these screens, as you can see from today, it's hard to know where to focus your eyes, what we're looking at. There can be distractions of people coming in and out of rooms. For example, my dog just opened the door right now as we're speaking. You need to account for that, and defense counsel. So when you're setting up, if you're going to be using, whether it's a conference call line or some sort of Zoom or other comparable technology, you need to have, you know, breakout rooms or waiting rooms or opportunities for people to converse sort of offline where they can feel secure. We all know this chat function that happens on Zoom is maintained by the user of the owner of the Zoom facility. So a lawyer can't send their client a note via this Zoom because they know that it is owned by whoever set up the call in the first place. So we still need to preserve those aspects to allowing proper solicitor-client communications to take place and allow lawyers to do their job of representing their clients, of course, without compromising the integrity of the investigation.
And we've actually offered solutions for some legal counsel and their clients in those circumstances. So I recall one in particular where we had a situation where the legal counsel and client were concerned they couldn't communicate with each other. And it was a simple solution, but I said, well, when we didn't have an ability for them to, they weren't trusting of the breakout concept within the platform we were using. So I said, no problem. When you guys need to take a break and you want to talk with each other, and it was only once during the entire interview, I said, mute yourselves, turn off your video, jump on your phone and FaceTime each other, you know, and they were like, oh yeah, that'll work, you know, and so, you know, sometimes it's just about being open to that. You know, I think as investigators, and Elyse made a really good point, the integrity of the investigation is important, but also transparency, fairness, you know, all those other things are also very important. And as investigators, we should be looking at ways to offer those solutions. If, you know, if we're doing this a lot, we're getting good at it. So let's offer those solutions to the people we're dealing with and help them. And Marc made a good point. I mean, quite honestly, a video interview, what's wrong with the telephone? Oftentimes you can do great telephone interviews. And again, depending on the context and nature of the case, that may be all you need to do. And it could be a good solution in itself.
So I just learned something new. Apparently the messages that Dean and I were sharing privately, they've all been recorded just now.
Yeah, careful. Yeah, we have a couple of questions on the chat line. One from Mina Kavanaugh about comment on the impact of regulation 73/20. Is that something for Elyse, or who would that be for? O.reg.
I presume we're asking about the emergency powers and the essential services, and if I'm speaking about the wrong regulation, let me know, because I don't actually know them by number typically, but I think that's what we're talking about. And I think that harkens back to what we're, and now I've got the chat open, so I think this is going to go to the next question as well, which is, what do we do about professionals who aren't working, or the converse, who are working now and on the front lines? And I think, again, the fact that some professionals are not working really goes to what are we investigating, and does it need to be done right now, and is this the best way to do it, or is there something that can be put off or delayed without compromising the public interest? Conversely, when we have those professionals who are on the front lines and who are genuinely, you know, putting in time in emergency rooms or other areas to keep us all well and healthy, or ability to survive during these times, we do have to take that into account. Now, that said, that's not an excuse when we're dealing with something that may be affecting the public interest. So what it might mean, though, is we may have to think about flexibility of timing. So I know some regulators who have adjusted their hours and who are working evenings or weekends to sort of accommodate individual schedules or their own schedules that are happening right now. I think for someone to take a blanket approach to say, I can't ever speak to the investigator because I'm working, is really not realistic. At some point, they're not working. Nobody is working 24/7. And if they are, then you would need some sort of evidence of that to take that into consideration. But I think, you know, when someone is objecting or not being prepared to participate with the investigation because of COVID issues, I think we have to look at what they're saying and certainly get more information so that you can assess the validity of those concerns.
Yeah, great question.
Anybody else?
Yeah, great question, Mina. And I think it may come back to the point that we all started off with. He says, what are we trying to accomplish in this environment, and how do we want to be viewed as a regulator? Are we going to be credible, thorough, sensitive? And really comes back to what Elyse said. What's going to be reasonable, and how is that going to be viewed? And how are we actually protecting the public by either advancing an investigation or maybe realizing that circumstances are not so dire that we actually have to go full tilt at this particular moment?
Yeah, I would. The only thing I would add is people refusing to participate in an investigation isn't new. They can come up with any number of wonderful and creative reasons why they should not, cannot, don't want to participate in the investigation, and that can come from the member side, and it can come from even the complainant side and witness side. And so I agree. I mean, you have to look at what are the okay, we'll hear you, we'll listen to what you have to say, and then let's make a decision, as was said, as to the validity of those reasons, and then take it from there.
Okay, great. So one question was about, and you sort of alluded to it earlier, Dean, with respect to PPE equipment for your staff or who's ever doing the investigating. So one of the questions that we had for the event is, what happens when you do need to go into a physical area and discuss, and it is too small for physical distancing? Is that a reason to? Is it just solving it with the PPE, or does that cause a major problem? Have you had a situation like that? Any of you?
We haven't had that situation yet. I would say that, you know, again, like everything, it comes back to how urgent is it that we get in there and do that now? You know, things are already starting to open up and things are changing, and we're not going to be physical distancing forever. And the use of, you know, let's face it, if I have to go into an office and you can name the profession, optometrist, chiropractor, dentist, dental hygienist, it doesn't really matter. If they're doing their job, they're not physical distancing, you know, and they're taking appropriate precautions to do what they need to do in that moment. And I think for an investigator, the same thing applies. Physical distance where you can. If you can't, make sure you have the appropriate PPE to do it in a fashion that's safe. And as investigators, I think it's also going to be important for organizations to be very willing to listen to their investigators. For example, I have an investigator who has an elderly mother who lives at home and could be very vulnerable. Now, if I have to pick an investigator or ask an investigator to go out into this world right now and do something out there, she's the last one I'm going to pick. And understandably so, where I might have somebody else who doesn't have a vulnerable person that could be at risk. Not that I'm expecting that they're going to go out and catch it and bring it back. We're going to take all the precautions we need to take, but let's be smart about it. Let's minimize risks every single place we can. And so I think if it's a serious case, the short answer, if it's a serious case and you have to get out there and do it, then you have the appropriate PPE and you do what you need to do as quickly and efficiently as you can. You get in, you get out, and you do it. And that's not going to be a decision an investigator should make alone. I think that's a decision that should have multiple inputs to with the organization, so everybody's on the same page about what's reasonable and what isn't.
And I think you have to remember also the organization, of course, is responsible, whether your investigators are employees or you're using independent contractors, you have to still maintain a safe and healthy workspace for your people. And so you do have to assess the risk that is involved in sending someone out to an environment that no one's been in. And if you're not going to be able to provide those staff people or individuals with the appropriate safety mechanisms, then you could be putting them at risk, and you may find yourself with your own employment issues, either because they're going to refuse to do so, or that you have actually put them at risk. And some environments, of course, they're just not going to let you in. I would be surprised that a hospital is going to very soon let anyone come in their doors unnecessarily without really some significant justification for why you need to physically be in that institution. So I think that's something we have to keep in mind. And I think the days of unannounced inspections are not going to be resuming for a long time because I don't think you can just show up now at someone's workspace and expect that it's going to be safe and that they're going to be able to accommodate you and let you in. And it's not a matter of being obstreperous or obstructive, but it's really going to be a fundamental safety concern.
Yeah. And to bring it to a gloss, we asked at the beginning, what kind of regulator do you want to be? But for those of us that are at regulators, we can also ask the question, what kind of employer do we want to be?
Right.
100%.
There's a latest question in the chat talks about from Brett. There has been significant discussion about use of mainstream platforms like Zoom, Dropbox. How do you overcome any potential privacy concerns of sharing documents or having conversations that contain patient identifying information?
Well,
might have addressed, but if we could again.
That's something we've been dealing with, and it's about using appropriate password protection. It's about ensuring that the people who have access to to these platforms are restricted, and doing all the things you can do technologically to ensure the privacy of those conversations. When you think about it, conversations can be overheard. I mean, even having an interview, one of the things that we always talk to people about is, who's around? Where are you having this interview? Who can overhear your conversation with me? They can hear me. Let's use earbuds. Let's make sure that, it's all about mitigating the risk everywhere that you can mitigate it, whether that be through password protection and encrypted services, all the way to having those practical conversations with the other party, making sure we're all doing what we can do to minimize it. Can we eliminate any risk of a privacy breach? I would argue we can do a heck of a lot, but I don't think we can completely eliminate it. And we have to just do everything we can to make it as safe as possible.
I think the good news is that these concerns existed beforehand. So it's not a new concern. How do we send information back and forth in a secure manner? And we do need to, every time we do send a patient record, we need to think about, do we need to send the complete record? Is there a way to de-identify certain information in case it does end up in the wrong hands? Whether we're sending physical copies or electronic, those concerns don't go away. And again, it's the same sort of principles when we're talking about general privacy practices, like with respect to collection, use, and disclosure. You should only be collecting the minimum of what you need to collect, and same with using and disclosure. And you do have to make sure that there is some sort of secure way. The question is also about the Zoom, where we've heard stories of Zoom hijackings and whatnot. So you do have to take those privacy practices where you know, all of your Zoom conversations should be password protected. I know when I started them with my friends, we weren't password protecting them. And then you hear these stories and you realize you do actually have to protect it. And particularly in this context. And if the system that you're using doesn't allow for that, then you do need to look at an alternative system, because they do exist.
Yeah.
So fortunately, the law does not require perfection of regulators, but what it does require is that regulators have this kind of a discussion and work through these issues. The law requires to show that regulators were forward thinking, contemplating these kinds of privacy concerns, and have some meaningful process to address them. Like both of the other speakers mentioned, things will get through the cracks. But fortunately, we've already had lots of experience in dealing with analogous scenarios. And I don't think privacy experts or courts would be too strict, too harsh with regulators in the rare situation that something does slip through.
Okay. So we started this, it's all about COVID-19, how to manage in COVID-19. Well, our strategy, as everybody, is to do post-COVID-19 and get through this. Just some thoughts. What do you think? And I'm not necessarily a crystal ball look at it, but maybe there's a little bit of that. But also we are moving to stage 1 and stage 2, depending on which province you are in, post-COVID. What will happen, do you think? Will they be permanently changing some of the approaches that will be that has been happening because of it in the investigative process and tools for going forward?
I think the
Sorry,
good news is
asking you to see the future.
I think
Go ahead.
No, but the good news is a lot of the things we're doing now, I think, are really going to help regulators be able to advance their investigative toolboxes, because you know, we've had situations where you know, people live far away. It is hard to get investigators, and we now have the means and abilities to conduct investigations. Some of us have been doing it for a while, but some of us, this is all new. And I think those are really positive things that we're going to see. I think the one thing everybody does have to recognize as well, though, is there is going to be a backlog, and there's going to be a fatigue on the part of your people. These have been really stressful, difficult times, and it's not like we're going to flip a light switch and go back to the way things used to be. And so I think we do have to appreciate and be sort of kind to ourselves that this is an evolving situation, and it's going to continue to evolve. And we need to do what we've been doing, which is working really hard to be able to react to any changes that do arise.
Really good point is that both as an organization and personally, we've learned a lot about ourselves and what we're capable of. So for example, our investigation team, although conducted most of their investigations virtually already, well, now we're doing so remotely. That's not something we had fully contemplated before all of this. And now we realize, well, what the art of the possible is and what opportunities might exist in this new working environment. Things that we hadn't contemplated are actually working really well in a very imperfect environment. So I agree that after this is all over, maybe there are some changes that are here permanently and actually might be for the better.
I agree. I agree that there are definitely a lot of learnings coming out of this that will make regulators, regulatory investigators far more efficient on many cases. I want to circle just back a little bit to something Elyse said about, you know, what about the idea of an unannounced visit? You know, just to be a bit of a naysayer here and looking at some harsh realities, unannounced visits will never be able to stop. At some point, unannounced visits are going to have to happen. You know, undercover visits are going to have to happen if we're investigating illegal practitioners. You know, fraud cases, sexual abuse cases, a lot of those things, unannounced visits are something we will have to do. And so when I'm sort of crystal balling it a little bit, looking at how do we do that. You know, it sounds a bit harsh to say, but you know what, we're going to have to just deal with it. We're going to have to, you know, if that means, you know, masks and gloves and whatever to get out and do what we need to do at some point in time. And I don't know exactly when that will be. And I don't think it will be that far down the road. We will need to get back out there and start doing these things. And we'll have to be thoughtful about how we approach it. You know, but that will have to happen. And so I do see us getting back out to some sense of normal, some sense of doing investigations the way we did them before. Like I mentioned the search warrant, that still has to happen. At some point, we got to do it. You know, when people are uncooperative and don't want to provide us with information, what's our alternative? We show up sometimes with a summons and we go get it. These things are still going to happen. And there's a lot of opportunists out there who will take advantage of, you know, if we have these blanket rules or we have these approaches that don't allow us to do the things we've historically done, then we may be setting ourselves behind the 8 ball a little bit as we move forward. So, you know, what exactly is it going to look like? I don't know. I mean, I think we're going to need to have the input of experts, and we're going to have to think it through. We're going to have policies around these things, but we are going to have to get back out there. And it's one of the reasons why we've invested in the PPE and all the things that we believe we're going to need to do it.
Okay. One of the questions on the chat is related to, well, what is the office that you're going after? If some people are working from home now, does that mean home has now been opened up for you as far as investigating?
I'm going to let Elyse talk to this one first.
It's a fantastic. It's a really good question. And of course, historically, if someone did work out of their home, the home did become the office and was certainly able to be the subject of a search or an investigation. And if I put on my defense hat, that was always why we said to health professionals who asked us, if you're going to have a home office, you should actually have a home office, because what you don't want is them coming in and ransacking through your children's bedrooms because there might be charts left there. So you need to, of course, have, from a privacy perspective, do that, but just from a pleasant life existence perspective, I think because people had to move, quote, home rather abruptly, and what did that really mean? So we have to look at, were people actually working from home? So if they were not telepracticing, but they were simply, you know, answering some emails and doing things, arguably the home does not then become the office. But if they were actually functioning from a home, then yes, certainly the home does extend to become part of the workplace, and I would say would be subject to investigation. So that is a reality, and it's not always the most pleasant thing to have to look to someone's home, but it historically has formed part of investigations, and it certainly, probably, likely more so in the future will.
Okay. One comment was brought up, and actually this has been a theme through all of our discussions, is the backlog, managing the backlog. Which one goes first? So which investigation? How will that decide? Who will decide that? Because in every facet there is a backlog. Who would like to start on that one?
It's a good one for Marc.
Yeah, it's a great one for Marc.
He's the regulator.
For all of us who are in regulation, we know there's no such thing as backlog. We have accumulated volume. And in that case, you know, there's no magic bullet, but we do what we've always done. We triage, and we triage every case that comes in the door, just like every regulator does or should do. We care less about when a file came in the door as opposed to the risk that it presents to people and so forth. So, that's not going to change, and this environment does not change that even a little bit. The question is, well, what happens eventually, and how do we chip down that? Well, that's the existential crisis of all of us regulators, whether that means rearranging our processes or staffing levels, but it does not change the process or how we tackle it.
And I guess I would add, just as an external investigator who works with multiple regulatory bodies, we're already starting to see a lot of requests, and we know the real push hasn't even started yet, but there is going to be a lot of demands, and so I think from an employment perspective, organizations have to look at that as well. I mean, we're hiring right now. Just had to slip that in there for anyone looking. But we're hiring now. Partially, we already have the work, but we're hiring to be prepared to handle that. But I agree wholeheartedly with what Marc said. It's all about triaging and deciding which cases are the most priority. And it's not certainly a first come, first serve sort of scenario. Everything needs to be looked at and considered from the perspective of public safety and public risk. And then you work through that backlog or that, I forget the phrase Marc used, but I liked it. But you work through it with those principles in mind and sticking to those principles as those decisions are made.
Just to bookend with Dean, one thing that we've noticed in this environment is we've also seen some opportunities. So for example, in our investigations, in some cases, people are responding to inquiries quicker than they would normally be the case. They're answering the phones or they're providing documents when they're able to do so. That's actually made some investigations become a little bit more efficient, perhaps unintendedly. So there's also some newfound opportunities in this environment.
Okay. Another question. What about offer of service out of province? I'm not sure the question, so I'm hoping somebody else understands it.
Well, I guess I'm just taking a stab at this, but I don't know whether they're talking about offer of service, like people that would be regulated now providing services because of things like telehealth and the ability to do things remotely. I mean, regulators aren't the only ones learning how to do things remotely. So are all the people we regulate. And so I guess maybe that question is, well, what if somebody in British Columbia decides they're going to provide services to a patient, if it's a healthcare example, in Saskatchewan? And is there some issue with that? And there could very well be. I'm not expert enough to comment on the legality of that, but if that is the issue, I would agree we may start to see that for sure.
I think from a legal perspective, some regulators have already had telepractice policies, and even the ones who had them, I think, were looking at them and re-examining them again in light of what's happened here. And some regulators were forced to sort of scramble to come up with telepractice policies. We have to remember, though, of course, healthcare is provincially regulated, for example, and so the rules might be different from one province to another. So again, I come back to where I started, that the pandemic doesn't mean all legislation goes out the window and we can do whatever we want. And that applies, of course, to the health professionals. So just because we can do something from a technological point of view doesn't mean that you're allowed to or should be doing it. So I think that's something that the regulators will need to look at is, now that we've implemented certain things that we can do technologically, can we provide those services across the provinces? Is it okay with the other province that we're seeking to do so, or the other jurisdiction? But it's not just the floodgates don't open because we can do something. And so that's another piece that the regulators are going to have to be working on as they do work through their accumulated volume, is the comparative policies to address some of the practical realities of the way people may want to practice in the future.
That's excellent. We only have a couple of minutes left, and I did want to get 2 minutes from each of you, just to sum up your thoughts, your opinion. But one thing was kind of a theme is are there going to be new investigations required because of this change? And Elyse, you actually might have just alluded to that. So Dean, since you're on the first one on my screen, maybe you could start. Just sum up a couple of minutes of insight from your perspective.
I mean, I guess first and foremost, I would say that this pandemic has really, I like to look at the pandemic and what we've had to deal with as an opportunity, not an obstacle. That's just the optimist in me, but it's about learning new ways of doing things. And I think we all are doing just that. We're all learning new ways to accomplish what we're expected to accomplish. And in that respect, I applaud all the regulators. We deal with so many of them. We see the things they're doing and the adjustments they're making, and that is a very important thing. And we're learning that we can cope and we can grow and we can evolve through these imposed changes. So that would be my first thing. Is the only other thing I would say is, in terms of what we're going to see, I agree we're going to see an additional flood of complaints. I think we're going to start seeing complaints, especially in the healthcare sector. We're going to start seeing a lot of complaints about a lot of things, whether it's long-term care, retirement homes, treatment in the hospital. I think a lot of the healthcare regulators are really going to need to be ready for some of the stuff they're going to see over the coming months and years.
Thank you. Elyse or Marc, let's start with you.
Yeah, great points, Dean. This is a moment and it's an opportunity for us to think as regulators, not only why are we doing what we're doing, but how is it going to be perceived by all stakeholders? Are we going to be seen as credible and thorough and fair and impartial? But are we going to also be seen as human and sensitive and understanding as well? It's an opportunity that can change our reputations or enhance them for years to come. So I see that as a tremendous opportunity. It's not something that we always reflect back on and see as an opportunity in all of our processes.
Okay.
Yeah, I really like what Marc and Dean have to say. And I think one other facet that we are going to see in this new environment is a lot of mental health issues on the part of our the people we are regulating. I think when things evolve, and I agree with Dean, they're going to have to evolve. People, I think, have been suppressing a lot and trying to go as best they can. And I think you're going to see some of those issues come out. And I think it's always been an area that's been challenging for regulators because, of course, we have to balance the ability of professionals to get help when they need it, but to make sure that the people who provide services are doing so in a safe and effective manner. And I think that's another area that regulators are going to have to keep in mind, that you will be seeing more of those issues, I think, surface, in addition to the onslaught of complaints that I do anticipate coming as well.
Okay. Well, thank you very much, everybody. I really appreciate it. We had lots of questions. Oh, do I have any more? Nope, just Alana speaking to all of us. So again, this has been taped. We'll be posting it in a couple of days and onto our YouTube channel, where we are also hosting the other virtual discussions. So thank you, panelists, Dean, Elyse, and Marc. Really appreciate it. Very interesting topic.
Thanks, everyone.
Have a wonderful day. And Dean, you're happy because you're sitting in the DR, so I don't know. That's why you're happy. Take care, everyone.
Stay safe, everyone.
Enjoy.
Bye.
Bye-bye.
Bye.